It is 6:45 in the morning. You're finishing your shift and you've been at the hospital since 7 p.m. the previous night. Your coworker asks you to help her finish with her morning pickup so that you can leave at the same time and go to breakfast. You decide to take Mrs. Douglas to room 23. She's a sweet elderly woman who was admitted for meningitis and is placed in isolation. Mrs. Douglas is comfortable with you, even though you're not her nurse. She's just woke up from a night of sleeping, and you tell her that you need to give her her medication. This will only take a few moments to administer, so you put on a pair of latex gloves and a gown before entering the room. As you're finishing, she coughs and some of her sputum gets on you. You realize that you forgot to put on a mask before entering the room. As a nurse, you know that meningitis is not spread through simple skin-to-skin contact, but through mucosal fluid. It is unlikely that Mrs. Douglas has spread the bacteria to you, but this incident has served as a wake-up call on how important it is to use PPE. What is PPE? Personal protective equipment, commonly referred to as PPE, is worn to minimize the exposure to serious workplace injuries and illnesses. Some high-risk career fields that require PPE are construction, electrical, and medical. These injuries and illnesses may result from the contact with chemical, physical, electrical, and other workplace hazards. PPEs include wearing gloves to protect the hands from germs and reduce the spread of germs, masks to cover your mouth and nose, eye protection such as face shields and goggles to protect the sensitive mucosal membranes of your body, clothing including gowns, aprons, head coverings, and shoe coverings. According to OSHA, there are 3 things to consider when selecting PPE. First is the risk for anticipated exposure, such as touch, splashes or sprays, or handling large volumes of blood or bodily fluids that might penetrate the clothing. Second is the durability and appropriateness for the PPE at task. Third is the fit. PPE must fit the individual user, and it is up to the employer to ensure all PPE are available in sizes appropriate for the workforce to be protected. The removal and disposal are just as important as wearing them. It is important to protect yourself and others from being exposed to germs. Before leaving your work area, remove all PPE and put them in the right place for disposal. This may include special laundry containers that can be reused after cleaning, and special containers designed to handle hazardous waste. You may need different protective gear for different patients. Your workplace should have written instructions about when to wear PPE and what type to use. You also need specific PPE for caring for patients in isolation. Ask your supervisor which PPE is best to use in each situation. Ultimately, it is up to you as the nurse to decide the appropriate PPE for you and your patient.